What we know about clinical trials is important, and the data collected helps us create guidelines. These guidelines are recommendations made when doctors, who are leaders in the field of breast cancer, come together and decide appropriate treatment options for women facing similar decisions. However, you should also consider what happens to women in the real world, because clinical trials have strict criteria, and the results may not be representative of all women with breast cancer. By analyzing large amounts of information, we can tell how the findings from clinical trials apply to the average woman, but they can also reveal difficulties women face when undergoing treatment. For example, these studies have shown us that some women may not tolerate the estrogen-blocking pills for 5 years. It is difficult to estimate some of these numbers, but anywhere from 33 to 66% of women, or 33 to 66 out of 100 women, don't take their estrogen-blocking pills daily as recommended by their doctors for 5 years, or aren't able to continue to take them for another reason. While it is difficult to know exactly why, it can be due to side effects such as fatigue and joint pain that may limit your ability to complete normal day-to-day activities and impact your quality of life. This is something you should consider if you decide not to have radiation therapy. In addition to the information above, you should consider other things that women have said are important to them in the decision-making process. A breast cancer diagnosis can be overwhelming. You will be given a lot of new information about your cancer treatment options and how they impact your quality of life, and what to expect when your treatment is over. We want you to know that this is a common concern for many women, and encourage you to talk to a doctor about how you are feeling. Consider telling your doctor how you want to discuss your diagnosis and treatment options. Every woman is different in how and what type of information they want to know. Do you prefer videos, or would you like to have information you can read? Do you want to hear information only from your doctors? Or would you like to know which trusted websites to go to for more information on the internet? Talk to your doctor about how they can best communicate this information to you. Consider bringing a family member or friend to your doctor's appointments. It may be helpful to have support when listening to conversations about your treatment options. While many women make treatment decisions on their own after hearing their doctor's recommendation, others find it helpful to ask their family and friends for their opinions and advice. Consider talking to other women you may know, or you may not know, who have been through a breast cancer diagnosis and treatment. Some women find it is helpful to hear about another woman's experience going through radiation or what they can expect when taking estrogen-blocking pills. Some women also want to know how this impacted their quality of life and what their life was like after treatment was completed. While your doctors can tell you what to expect, other women can tell you what the actual experience was like for them. If you would like referral to a support group, ask your doctor. Consider practical concerns, such as duration of treatment and daily responsibilities. If you decide to take the estrogen-blocking pill, it will need to be taken once every day for 5 years. If you decide to have radiation therapy, it is about 3 to 4 weeks, Monday through Friday, daily for about an hour. This does not include the time that it may take you to drive to the treatment center. If you have family responsibilities or transportation concerns, this is something to take into consideration. Consider how the treatment impacts your quality of life. You need to weigh the risks and benefits of each therapy you are considering when making this decision. Each therapy will have different side effects that may or may not impact you. For example, during radiation therapy, you may feel some fatigue, but you will recover. Most women who work will be able to continue to do so during radiation therapy as the side effects are tolerable. When taking estrogen-blocking pills, joint pain may feel worse. You have options of switching to other medications, but you may not be able to tolerate them and may have to stop. Talk to both your medical oncologist and radiation oncologist before making the decision regarding radiation and the estrogen-blocking pill. Consider talking to your doctor about your financial concerns. For some women, this can be a big concern when making treatment decisions. Your doctor may have resources they can refer you to help you better understand costs. These are all important considerations to keep in mind when you are making decisions. Remember to ask your doctor about any questions you may have after watching these videos.